I'm going to get us started. Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. And I want to thank you for joining us for this week's Boulder County Public Health COVID-19 Safer at Home Update, specifically designed for houses of worship. Just for a reference point, we've been running these webinars, I think we're at 103 or 104, since April 30th for different industries within Boulder County to help answer questions, provide information, and accurate information. I know there's a lot of misinformation out there, and to provide opportunities for feedback when available. The way this webinar will work is that we'll provide an information part by Boulder County Public Health. They'll go through the requirements, the rules, the safer at home portion, and then we'll open it up for Q&A. At this time, I'm going to ask you to put your Q&A into the Q&A feature of the webinar and through the chat. I also received quite a few Q&A questions via email beforehand, and I'll try to cover as many as I can. Once we get through those, if we're able to, and we can handle the number of people on the call, I might be able to open for some live questions if time is available. At this time, I'm going to hand it off to my partner in this webinar series, Boulder County Public Health, Jesse Rounds.
Thank you, Corinne. As she mentioned, I'm working with public health, and we'll jump right in here. And as we go along, you'll likely hear from my colleagues Lane and Kelly, who are experts in a lot of this. So just we're gonna work together to answer your questions as we go along. So what I want to do today is give you a little bit of overview of where the county is with respect to COVID-19, talk about the public health order update, and then get into resources we have available, our process, any guidance we have, and then jump into that Q&A because I know you have lots of questions and we really want to be able to answer as many of them as possible. And maybe this is a bit giving it a little bit away, but if you don't get to answer your question or you think of a question later, my email will be at the end of this, and I will repeat it many times. You can get in touch with us. We are happy to talk with you, to work through this, work through any questions you have. So with that, I'll just get started. This is for weeks before this was a great chart to start with. Unfortunately, it is not as great a chart to start with anymore. In the last 2 weeks, we've had a huge spike in the number of new coronavirus cases, COVID-19 cases in Boulder County. We are now the county with the most new cases, and that is a worrying trend. Before this, we were on a downward trajectory. Even after CU got back in session, we were seeing a little bit of an uptick, but things were okay. But now we're not there anymore. So a lot of our goals are about trying to get back to that. In terms of the 5-day average, this is just looking at Boulder County. Again, same trend you see in that other chart, just isolated here. And it shows you a little bit of how big this increase is compared to any of our previous spikes. And I think that's an important detail. As I'm sure you're aware, most of our new cases are in that college student age demographics of 10 to 19 and 20 to 29. We are seeing new cases in across all age groups, but that is where we're seeing the biggest change. So public health order updates. I did not change the slide since this morning. Obviously there's the dial and we are going to talk about that. But the other thing is the state mask order was extended. The indoor mask wearing is required by the state in any public space. And that is any space where people from various households get together, basically, is the easy way to put it. And then obviously the update to the dial came yesterday. So we'll get into that. And here we are. And just so you know, this graphic is from the state website. It's a static graphic. That dial level has nothing to do with where we are on the dial. Corinne showed me right before this that the county's website is now up and running where we're tracking this, and it correctly shows us at level 2 of Safer at Home. This was just a cut and paste from the document that the state put out yesterday. So just want to clarify that right away. We are at level 2 within Safer at Home at this time. And the dial is really intended to allow some flexibility within Safer at Home as we have either more or fewer cases. We can move between these levels, and that will really affect capacity of our public spaces. And the way that the state will administer whether we move between any of these levels. Protect Our Neighbors is the least restrictive level, and that is still, you still have to meet all 8 metrics that they published about 2 months ago, and we are still tracking how we meet those metrics, but that is, we still have to apply to get into it. All those sorts of things remain the same for Protect Our Neighbors. Within Safer at Home, these metrics are how we, how we measure up. And I was just looking, based on a question from our last webinar, I was just looking at the state's guidance on this. To move up a level, so to move to level 1 from our level 2, we need to meet all 3 of the metrics, the 0.75 per 100,000 cases in a 2-week period, 5% or less positivity, and a declining or stable hospitalization rate. And that's how you move up a level. If we fail to meet any of the 3 metrics within Safer at Home level 2, there's a 2-week period in which the state says, hey, you're not meeting one of your metrics, you may have to move down a level. And during that 2-week period, we as a community can do what we can to try to stay within Safer at Home. If our levels stabilize, then we stay in Safer at Home level 2. If they do not, we would move down to Safer at Home level 3. So that is, there is a correction period before you'd move down. With respect to, so the biggest thing, as I said before, about all of this dial is that it's about capacity. And for places of worship and life rights, the capacity at Safer at Home level 2 is the same as it was under the original Safer at Home, where there weren't 3 levels. That's 50% of capacity, or 50 people, unless you have a large space, in which case you can go up to 100. And one of the things that has come up a couple times, and maybe something that we want to talk about with all of this community, is that 100 is per room within your building. So if you have a number of large spaces, and the calculator says you can have up to 100 in those large spaces, then you can do that in multiple rooms. In other words, think about using your entire building space as worship space, if that's possible. That's something that we would work with you. You contact us, we can walk you through that. But to focus on this a little bit more, at Safer at Home level 1, indoor capacity would go up to 175 people, or 50% of capacity. If we went down, obviously we'd go down to 25% capacity. And I do want to explain the asterisk on Protect Our Neighbors. That is there to indicate that the longer you stay in Protect Our Neighbors, your capacity goes up each month. Your highest capacity goes up a little bit. So that is what the dial means for places of worship and life rights. And I think that's important to note, that right now we are in the same place we were last week and the week before, and since, I think Corinne said April 30th, it seems a long time ago. So to jump into resources, really the two resources that I think are really important are covid19.colorado.gov, which is the state's website. It has all of the guidance you need for how to operate uh, under safer at home. Things like you need to wear masks, you need to clean spaces regularly, parking lot guidance for outdoor events that aren't related to either a religious service or a life rite. Um, those sorts of things are on the Colorado Department of Public Health and Environment website. On the Boulder County website, we have contacts for us. We have specific guidance, and one of the things we're working on that will go up there, and it's changed because of the dial, is guidance on how to, for example, if you want to have an event outdoors, um, to get to your maximum level, you have to work with us. You have to submit a plan, and we'll work through that with you. That's something that we will put up the requirements for on the website as soon as that's ready. The dial excitement sort of set that back a little bit because we needed to get the website up for the dial. So those are our two big resources that I think are really important online. And again, you can contact me. My email address is jrounds@bouldercounty.org. That'll be written later. Please do get in touch if you have questions or comments. And in terms of support, we have covidbiz@bouldercounty.org is my whole team's email address. We have a number of people who are expert in both houses of worship and life rights. They would take your question, contact you, work with our legal team and our public health experts to really get the right answer for you. We're here to support anybody in the community, and we recognize the incredible value that houses of worship provide to all of us. And so we want to be here for you. I said it before, if you're thinking about a large event, get in touch with us. We can help you. We can define what the maximum possibilities are. We can come up with maybe creative solutions. That's what we're here for, and we do want to help. In terms of your patrons, this is a slide that I stole from another presentation, but it is still true for your houses of worship. You need to put a sign on your front door that says that masks are required. Masks are required in every public space. That's a state level public health order. For the county, if you have an outdoor service or an outdoor event, if people cannot maintain 6 feet of distance, or they can expect that they will not maintain 6 feet of social distancing, they also need to wear a mask based on county regulations. But at the state level, the order is if you are inside a public building, you need to wear a mask. I can't stress that enough, that masks are required for everyone, employees, customers, parishioners, faith leaders, everyone needs to be wearing a mask. There are caveats, obviously, for choirs during performances, and that is something that's in the guidance, and we will get into that right here. So these are the required safer at home. This is the required safer at home guidance. I put this into the slides on Friday, and I'm very glad that the dial didn't change a bunch of this. But indoors, again, your maximum capacity is 50 people, or 50% of the room capacity based on the social distancing calculator. If you have a large room, you can get up to 100 parishioners in your space. Outdoor, you need to distance, and your maxes are, I believe, 175, but that's only if you come to us and we work through how that would work. So For physical and social distancing, and again, these are just the guide. This is the guidance from the state. Entering and exiting buildings should be at least 6 feet apart. So one of the things we recommend is having different entrances and exits, or use all of your entrances and exits. That allows everyone to stay 6 feet apart. Arranging seating so that people can maintain their households, but also be 6 feet, more than 6 feet apart. We ask that faith communities look to additional services as a way to accommodate the size of your community. One of the things that we really do want to encourage, as I said, was that use of multiple large rooms. A room is anything that has 4 walls and a door. You can use multiple rooms in your facilities to accommodate more of your parishioners. So I think that's it. Just thinking again creatively how to use the space that you have. Cleaning practices. So the CDPHE, College Department of Public Health and the Environment, has cleaning guidance. I don't want to go through all of it, but it is very detailed. It tells you what chemicals can be used and when you can use them and where they can be used. Restrooms need to be cleaned between services, and surfaces that are going to be touched by multiple people should be disinfected between services. Check the CDC website. Another place that people have found a lot of useful information that I encourage people to go to, especially as we're going to more of an indoor season, is checking your ventilation system, having it checked by a professional, making sure that it's running at its best, and that you're using the best equipment you have available. You can use the OSHA website. That's the I don't remember what OSHA stands for, but I can tell you that that is an important place to go to get details about, especially air handling equipment. I think it's the Occupational Safety and Health Administration. Anyway, okay, I'm being told to be louder. I'm working on it. So recommended guidance. This again is from the state. Face coverings. Again, face coverings are required, but in certain situations, again, like choirs, you wouldn't be wearing a face covering while you're singing, or a band, I should say. But you do want to cover up in between songs or whatever. You want to limit the amount of time that you're not wearing a face cover. Employees and volunteers, and I have all the notes here, but employees and volunteers, you want to protect them. You want to give them as much PPE as they need to feel comfortable. Whether that be medical grade masks, gloves, whatever they need. You want to protect your employees and volunteers. One of the things that that's also recommended is pre-registration. So we know, and if there's an outbreak, you can contact people and say, you were at X service, you were at X event, there was a sick person at that event, and that's a tool that pre-registration for an event can really address. Another option, or another thing to pursue, is symptom screening. As people come in, take their temperature. Obviously, for a very large event, that might be difficult, but it is a great way to ensure that the people sharing your service with you are healthy and safe, and that keeps your entire community safe. And I mentioned before, separate entrances and exits and marking those, directing movement with arrows, and saying, this part of the sanctuary needs to move out through this window or through this door, or come in through this door. That's a really important tool for reducing interaction, unsafe interaction, I should say. And then creating a touchless experience, reminding people that right now, shaking hands and other things, it's a great way to transmit the virus. And then again, speakers, worship leaders, and choirs, need to maintain a distance during the service from the audience in order to limit the possibility of transmission, because speakers might not be wearing a mask, because bands and choirs might not be wearing masks. You really do need to think about how do you maintain that distance that is required to safely have those experiences. In terms of variances, the CDPHE is, and we don't have this, I don't have the slide here, but basically variances are only now being accepted by the state for very large spaces and in very unique circumstances. I think Corinne, Lane, and Kelly, I believe the number is 30,000 square feet or larger is the space, type of space that gets a variance at this point. But outside of that, Boulder County Public Health wants to work with you. We consider you all partners in our community building, and we need your help. We are looking at this as a community-wide effort, and we want to maintain communication with you. We want to help you. We recognize that the end of the year, the end of the calendar year, there are a lot of community-wide religious events that have a lot of meaning for a lot of people, and that's very important. And so we want to be able to help with that. So we're going to develop guidance, and we're going to be doing that in concert with you. And that's really all I have. Again, I forgot to update this slide. Obviously today we have this session. So my Wednesday 4 p.m. session, usually each week that's our special session where we dig into one industry or one specific subject. Our 3 p.m. is for general updates. If you continue to have questions, I really encourage you to come to those sessions. Corinne, Lane, and I spend a lot of time answering an incredible variety of questions, and we're happy to do that. And we really want to get to hear from everyone. So please use that Wednesday session next week or in the future to listen in, ask questions. Over the next couple of weeks, we're going to be digesting this dial and trying to understand it and trying to give the best guidance we can. And hopefully we'll be moving up that dial. And so in future weeks, we'll be giving good news about the changes in capacity. There is a Spanish language session that I really encourage people to listen into. It's co-sponsored with the Latino Chamber and Boulder Chamber, and it's released on Thursdays. They dig into specific questions, and it's a valuable session, and I encourage you to listen in. And with that, I wanted to the 3 people that I think most are your best direct contacts are Maciel, who's our Houses of Worship and Life Rights expert, me, and then Lane Drigger as well, who's on this call and will probably be answering many of your questions in a moment. With that, happy to answer questions.
Jesse, if you would go back to the variant slide, I was just going to point something out for folks. So in combination with the new dial, where we're at currently, there is provisions for site-specific variances. Unfortunately, right now, those are only for outdoor. So for those people looking at outdoor services that they want to exceed the 175 capacity, we do have latitude to review and approve numbers beyond that. But for indoor, we do not have that until we can qualify for level 1.
Thanks, Lane. Appreciate that.
And that hyperlink gets into some of the specifics around that. And then I think we're going to have some other resources on our website that are going to walk through, if people are thinking about larger events, some of the information we want you to think through and present in a plan.
All right, so it's question and answer time. We have a lot of questions, and I'm gonna, for everybody that's on the call, just for your knowledge, I don't go in order because I try to group them into questions that are on similar topics so that we can get through those questions and make sure that we cover that topic to the best of our ability. I'm gonna answer quite a few questions with one statement. The recording of this webinar the resources mentioned in this presentation, including all of the links and everything that Jesse mentioned, will be sent out in an email to anybody that registered for this. It is a follow-up email that will come from me that includes the email addresses, actually downloadable signs, the mask signage, the do not enter if you're sick, maintain social distancing, all of the sign resources that we created over the last couple weeks, we want to make available for you to be able to print and use within your facilities. So we had quite a few questions like, how do I get my hands on that sign? Or will this be available? Or how do I get my hands on this information? We'll also set information on the dial resources, the Boulder County tracking of the dial resources, the Boulder County tracking of the Protect Our Neighbors indicators, and then any data tracking. So you will get a follow-up email from me with everything that you saw today and a recording of this webinar. So please know that if you're massively taking notes or you don't know where that link goes, we will provide that for you. So we don't want anybody to miss out. Let's talk a little bit about the data first. There were a lot of questions about data and the parceling out of CU students from the data. Some of the questions came as to whether or not we would be in the condition we're currently in if we didn't have CU students in our community. So, I think the first question is, would our numbers still be trending up? And then the second question is, would we still be in the same condition we're in if we didn't have CU in our community?
These are interesting questions. We do have CU in our community, so as far as if we did, we do. So, so it influences all sorts of things. We've had CU in our community all along. They were here in March. We had some level of student activity throughout the summer, and we certainly have student activity now. I don't have all of the data to tease out, but I can tell you that this spike that you're seeing on the slide that's up is not entirely CU. It has a majority. We were seeing upwards of 60% of the cases were CU students, but not 100% of the cases being CU students. So again, it isn't all or nothing with CU. That being said, I think we have had dialogue around, is it appropriate to try and treat CU as its own entity, potentially have its own dial, and look at, again, we are treating it separately right now. We've worked with the city and the university, and so right now the students are in a stay-at-home order. So, kind of situation where they should be really only going out to eat, to go to doctors, to go to work, but not go out for general socialization. So right now we are treating CU separately as far as trying to do that containment. Otherwise, even with CU, we are meeting quite a few of the metrics to move us to level 1. So right now, the overall first metric of cases is where we are not there. We're actually closer to being on the bubble of moving to level 3. But I think we're hopeful that we will at least stay in level 2 for right now, and then look to see if we can qualify to level 1.
So, Lane, can I jump in there for real quick? I spoke with our surveillance team today, who I speak with normally, and I think we're at 219 cases per 100,000. So we're actually kind of swimming into number 3 right now. But again, we're going to look at that in a couple weeks down the road to see if some of the interventions at CU have impacted that and lowered that.
So this leads to 2 additional questions that came out, which are, how does a church or a synagogue or another religious facility in East County, why is this pertinent? Why are CU students, why is that pertinent to them? And why should the numbers that are happening at CU impact what's happening on the East County side?
Well, again, as far as what's impacting, nothing is changing. We are still in level 2 everywhere in the county. So we aren't putting stay-at-home orders within Lafayette or other communities. This is very specific to areas of Boulder. So we are treating parts of the county differently in some of our strategies. But we do know that people within our community live in one area, work in another area, play in another area. So to say that no one in Boulder moves to another part of the community and vice versa is not a fair or true statement. So there is interaction across our community. So what is happening within one part of our community can and certainly does have potential to influence others. I don't know and don't pretend to know the demographics within each one of your specific groups, but you may have people that are from Boulder, you may have people from other communities that attend your facilities. So, you know, those are pieces. We know that people, again, work within the community. So there are risks that our community sees based on things that are happening within Boulder and CU specifically.
In fact, on our earlier call today, we had businesses in East County, all over the county, who employ CU students within their facilities, asking how the quarantine affects the employment at their facilities. So we have CU students that are employed at jobs all over the county. And actually, we have another question here that says, could a student get in trouble or be disciplined by the university for attending a church or a house of worship during a quarantine time?
I don't know that is a restriction to prevent them from going to a house of worship. I think that would be an infringement if to prevent that activity, because I don't think that was prevented under stay at home specifically for people. So we would want to make sure that you're doing all the precautions that you should be doing already. So, and part of that within houses of worship is to be doing some screening and making sure that if anybody has any symptoms and concerns that they are not attending your services. So that's not just for CU students, that's for all folks. And so I think these are really important pieces. If you know you do have students, really making sure to do those levels of screening and verify that people are not sick that may be attending any of your worship ceremonies.
All right, so we actually had a comment from someone that said, this community would be a lot different if we didn't have CU. There'd be a lot less Boulder without the college. Our economy would be a lot different as well. So just a comment that was made.
It would be a very different community. We would have different tax revenues. There'd be different levels of job and employment. And so as much as we're seeing concerns with this disease specifically, there's lots of factors around having a university and having employment and opportunities too. So it is a challenge, but there's other things that it would look very different if we didn't have that too.
And to close out the CU question, I think I'm going to ask you a question that came up on the earlier webinar, which is, and Lane, your answer I think is important for this group as well, which is, at what level do we need to get for CU to go to online? And I think talking about why closing down classes may not be the solution may be a good answer for this community as well.
Sure. So from what we've gathered, and again, it's very difficult to pinpoint anybody who gets ill exactly where their exposure occurred, but as far as looking at all the risks, especially within the CU population, the classes themselves do not appear to be the highest risk exposures. And so going to online is not likely the big solution to changing what's been happening. Certainly the first few weekends of school, there was significant party activity happening, lots of groups gathering, congregating, certainly well beyond what the orders allow, people not social distancing, people not wearing masks, versus in the classrooms, people are social distance, they are wearing masks. So we have looked at any potential exposures within classroom settings, and really that's not the big concern. So going to online is not really the solution, I think, to the immediate problem. And again, having students potentially have more time and still be within the community and not addressing the true risk factors is not going to change things.
All right, so we want to get into some of the specifics because we have a lot of questions around that. Specifically, we have one more question about data, and this is not around CU data, but around data. Some of the, at least one person on the call is tracking data for the congregation and maintaining a dashboard for them to use. There's county data or additional data they'd love to get. where do they find that additional data they're tracking? Is there someone they can contact, or should we send out the link to the data that the county has, or should they contact the county?
Yeah, again, not knowing what data they're looking for, there is extensive amounts of information on our website. So, and we do have a link specifically for our data section. So certainly that would be where we would direct you, because I think you're going to find a lot of information. So again, not knowing exactly what you're looking for, but we didn't show anywhere near all the data that is being tracked and is being shared. So there's lots and lots of data that is being acquired and put
What
out.
I'll do is in the email, I'll send a link to the data dashboard for CU, the county, and the state. Within the county, it breaks it down by municipality. It breaks it down by ethnicity. It breaks it down by a lot of different, different indicators that may meet some of the needs within what this person was asking. And then, the state site does track, outbreaks and some other data pieces that may meet some of those needs as well. So again, this is the first time this group has been on a call with any of us. So just to know that you'll get probably more information than you'll know what to do with, hopefully on the follow-up email with a lot of links and a lot of information. So you just went to the perfect slide for the next question, Jesse.
The next one, Kelly's got a.
Yes, go ahead, Kelly.
Sorry.
Yeah, I'd like to add to that a bit. I just wanted to say that the numbers on the CU dashboard and the BCPH dashboard for cases don't always align, and that is because the CU dashboard is only looking at like their information from Waldenburg, where ours is more comprehensive in general with that. And you're exactly right. There's a ton of information on there. We have a team of 4 people, with 2 people just starting on our surveillance piece. So our bandwidth and our capacity is at the breaking point with that as well. So, if we work with the municipalities, for example, and send them like municipality focused data like once a month. And so, if you have questions specifically, we may be able to answer those, or we may not have the capacity or the bandwidth to answer some of those as well. But I agree with Lane and Corinne is that please look at, the website, because there's a lot of stuff on there.
All right, so I think the question, this question may have come in prior to you getting to the specific guidance, but just in case it didn't, the question was, what is considered a large space or an extra large space? So prior, it was 50 max unless it's considered an extra large space, and then you use the social distancing calculator. So what's considered a large space? And I think you can answer it right here, right, Jesse?
Yeah, so, and I do want to provide some nuance there. So the space, facilities with rooms larger than 7,200 square feet can have more than those 50 patrons. However, and I think this is an important detail, you have to use that space calculator that's available on the state's website to figure that out. So the 100 is a maximum. That's only in the very largest rooms where you can maintain a 12 square foot space around each person, theoretically, that you get that maximum of 100. So really be cautious about jumping to that conclusion. Again, that's why we keep bringing up that use multiple rooms, because even though you might have a small room that can only fit 20 people or 15 people, that's 15 more people that can be at your service that couldn't be there before or can't be in the main room. It obviously stretches some technological know-how to make that work, but it is an opportunity. And that all goes back to that question of 7,200 square feet or larger. Yes, you can have more than 50 people, but it only goes up as the social distancing calculator, recognizes that more space allows more people. So that's
to 100 as the max. So
yeah.
I think we have quite a few questions that come in that say, we're interpreting it as we can go to 100, but then when we use the social distancing calculator, it says we can have 54. But in actuality, they can have 54 above the 200 square feet, not up to, not 100.
Yes,
Correct.
exactly.
So the 100 indoor is a maximum. So the smallest space that would accommodate that is 14,400 square feet. And that would mean you have a completely vacant space. There's nothing else in there that's taking up any space. So as soon as you start adding anything else in there that's starting to block some of your space, you know, that's what the calculator also, it estimates the percentage of floor space that's occupied by furniture, equipment, displays, and other things like that. So again, you need a very large space to ever get to 100, but just because you're at 7,200, again, that maximum would be 50. So again, with nothing in it, no furniture, nothing occupying any other part of the floor. So this is to accommodate allowing people to still socially distance and pass each other. So it isn't about, well, we could easily fit 500 people if we all were 6 feet apart. You know, no one could ever move then if you packed in a space and allowed everybody to be in there and be only 6 feet apart. So.
And right now, the Boulder County is following the state guidelines on these. You're not making it more restrictive. You are in complete alignment with the state numbers. This is not something you're trying to restrict it at a higher capacity, correct?
Yes,
Correct.
we follow the state's guidance.
Yeah, and just to be clear, I know the state website talks about guidance. These are the order requirements, the public health orders that have been put in place. So these are not optional, they are requirements. So just to make sure people don't make distinctions that this is just suggestions.
And because they're state orders, your role as the local health department is to enforce the state order, to help clarify and enforce the state order at the local level. But you're trying to enforce what's been put in place at the state level.
Yes, I mean, we're enforcing, we're helping, providing information, and as Kelly mentioned, a large part of our team is also looking at tracking and understanding what's happening. So, but yes, we're interpreting and enforcing as opposed to creating regulation.
The only exception is we do have a mask order that addresses outdoor spaces, where the state mask order is only addressing indoor spaces. So aside from that, we have not added any additional restrictions on any specific sectors.
So someone said, so a 360 square foot room could have 2 people. If you're using the social distancing calculator. And the way the social distancing calculator works, it's 144 square feet per person. So it's 12 by 12 to allow 6 feet in each direction. So that would be correct. So I think we have a lot of churches and religious facilities on the call that have large facilities and feel like they could safely fit more than 2 people or 54 people or 100 if they're 30,000 square feet. You know, the idea of capacity based on percentages. What role are the county health departments playing in pushing back to the state in some of these limitations and these capacity limitations? And I know the dial system does address some of this in some ways, but in what role have the county health departments played in trying to push back on behalf of businesses, on behalf of places of worship, to say that some of these restrictions are a little arbitrary based on the size of the facilities that we have?
For probably several months, that's been happening at the local public health to state health and to the governor's office specifically. So there's been dialogue on a weekly basis and in some cases on a daily basis to look at what the orders say, how they're written, and what maybe they should say. So the dial is definitely some edit to some of those things, but that's been happening for a long time. That being said, because a space could normally fit thousands and thousands of people, that was never established with any public health focus other than maybe a life safety focus. So again, we're not looking at how many people you could fit into your space without any COVID situation. So while there are some of the numbers that have been set by the state are more difficult to swallow, and we think there are ways to address things, going up anywhere near maximum capacities is never even a thought for public health either. So there's a lot of factors. It's not just about how many people you can get into the space. It's getting them all in. It's accommodating bathrooms. It's accommodating all the movement of people that, again, are not the thoughts of how these spaces were designed. So if you put 500 people into your space, how are those people being managed as far as how they get in there, as far as they're going to the bathrooms, all those other components to managing this disease. So again, while some of these numbers may feel arbitrary to some folks and feel too small, we aren't looking to go to fit as many people as you can in. So again, we think there could be a better place. And once we get to level 1, we have some more flexibility to look at those things. But again, we have incidents of disease in our community right now that need to get under control.
And so then really quick about the social distancing calculator, the philosophy behind it is an individual is 12 feet away from another individual. And it's this idea of, you know, one person away from others. Faith communities often have family groups gather for worship. Does that take into account that whole idea of family of 5 occupying 144 square feet together? Is there any way to accommodate that?
So and Lane, you may have a better answer than I do, but the calculator doesn't take that into account necessarily, but you do need to think about, so you have that family of 5, they can all be close together, they live together. And one thing I do want to mention is we consider households. So you may have a family group that lives in many households. Because they live in many households, they, you know, from a public health perspective, at least when it comes to COVID-19, they're not a household. Household is just the people who live together in a house, in a living space together. And I think, you know, this came up very at the end of the school year with graduation. And one of the things was, if you had a student with 2 parents, well, how does that work when they're sitting down? And what we talked about, again, this is that opportunity where you call us up and say, how does this work? We can walk through this with you. We said, well, think again about, you need to be 6 feet from the outside 2 people of that group of 3, or 6 feet from 12 feet from the outside of the group of 5. And same in other directions. Like those household groups can be together, but they do take up more space. And that's, again, going back to Lane's point about, just because you can fit a lot of people into a space doesn't mean that that's the safest choice in this pandemic.
And I think the flexibility, again, we do have is for outdoor venues. So again, the things that people are bringing up are absolutely things that we can look at and accommodate for outdoor spaces. But indoor spaces at this time, it is going to still be limited to 100. You can have households sit together and they don't need to be 6 feet apart. So that's fine, how you want to do that and accommodate, but it doesn't allow you to increase that capacity beyond whatever your restriction is based on your square footage, and then that 100 total cap. And part of that is we know the risks for indoor exposure are dramatically higher. You know, they're projecting 18, 19 times more risk of getting COVID indoors versus outdoors. So again, doesn't mean outdoors you're completely fine, but the risk is dramatically different. It just based on, you know, the volume of air that's being shared and the volume of air that's moving around. So.
All right, so a couple questions about mask. So besides just the mask sign, there's some clarification questions, and I think it might be helpful to talk through. If a person is in a space by themselves or in an office by themselves, do they have to wear a mask?
Sorry, go ahead.
No, I was just saying, again, I'm not sure the first part of in a space by themselves. So If that meant in a building by themselves, no.
If they're in a building, if the building occupancy is very low, one person, or they're in an enclosed room with a door shut, do they have to wear a mask?
I think the answer is no. When you're by yourself, you don't have to. The caveat being, if there are people that will be coming in and out of that space, you would need to have a mask on. But if you are completely alone, you'll be alone all day long in this building, you do not need to wear a mask.
Yeah, I think one example, and Corinne, this is something that you and I have talked about in the past because both of us have been in our office at times. When having a mask nearby is really important, because what if someone comes into your office? I work in a cubicle in a large room. At the time I was in the building by myself, but if someone came in the front door, I had to have my mask on because I was in a space shared with another person.
Yep. So this is some of those things that are covered in the mask frequently asked questions on the state website, which I'm adding to my list of things to send along, because within the facility you might have an office component that might fall under that office part of your facility that we can help you navigate as well. You mentioned a little bit, I think Lane, you mentioned, and Jesse, you also mentioned that the mask order in Boulder County is a little different than the state order. And there is a question about how the mask order outdoors in Boulder is different than the state order. Can you just clarify that again one more time?
Yeah, well, there is no outdoor state order, is I guess the simplest way to put it. So as far as following our Boulder County outdoor order, that's really, there is only one. That being said, our municipalities, I think in all cases, also have municipal orders. So depending on where you're located, you would need to make sure you look at what your municipality requires. I know the city of Boulder and Boulder County's orders are in alignment, but some of the other municipalities have different age thresholds where they require masks outdoors. So we encourage it for everyone 3 and older, but it's not required until you're, as per the state, is 11 and up. So again, it's really looking at the younger kids are the ones where there are some exceptions of them having to wear a mask indoors and outdoors. But for Boulder County purposes and really for the municipal purposes, outdoors, when you cannot maintain 6 feet of social distancing, you need a mask. That is pretty consistent for every order. It's just the age at which that is required is where you start to see some differences amongst the municipalities.
So there are a couple, our favorite HVAC question, Jesse. Do we have any information about the dangers of air being recirculated under HVAC systems? And before you answer, I will add to the list the HVAC webinar that Boulder County did with the state air team. I don't know what to officially call them, but I'll add the HVAC webinar about circulation of air, but go ahead and answer the HVAC questions.
So as Corinne mentioned, there was a great webinar that was put on in collaboration with our PACE team, Boulder County Public Health, and the state. Provides a ton of information about what you need to do to make sure that your HVAC system is up to code. In terms of air circulation, if your HVAC system is running well and has the right filters in it, it will help. Obviously, filters don't filter out everything. It's not possible. You do want to increase circulation. If you have the opportunity to have open windows, although we are leaving open window season relatively soon, you do want to have open windows. That circulation is important. If the filters are working, air recirculation is fine. You do want to increase the amount of fresh air input into the system though. Fresh air is your friend in this case. I mean, it's really a friend in most cases. You know, so I don't know if that directly answered the question in terms of, you know, the danger of recirculation. I think really what you're looking at is, do you have good filters? Do you have a high fresh air input? Then you're in a good place.
Yeah, and I just would add that the risk for this virus, it is not an airborne virus. So again, it gets really into nuances of droplets versus airborne. So, so things like measles are a huge concern for indoor spaces. We wouldn't be talking about any of this if this is where we were at, because anybody who's in the same room can be exposed. We're really looking at those specific droplets. And so those are not something that are going to stay suspended, go through your air circulation system and come back out the vents somewhere else and still be that level of concern. So that being said, oscillating fans and things that can move air further from one person to another right in the same room do give a little bit of concern, but your air handling systems, if they're again evaluated and make sure that you're working, you're changing your filters, looking at those air ratios of what fresh air makeups are, that should still be fine if you've made sure that those are balanced and running appropriately. We don't have the same concern that this is something that stays airborne for, you know, long periods of time and days, and then can be circulated through and continue to infect people.
Okay, so a couple just specific questions. You mentioned choirs. There's a question, a question about how many people can have in choir, and then probably how far away the choir needs to be from individuals.
So Lane, if you can answer some of that, I'll look at the numbers. I don't believe the state has a how many people you can have in the choir. But if you want to answer the performer question, I'll take a quick look.
Yeah.
Or Kelly, if you know.
No.
Performers, the concern again with people singing, playing musical instruments is that you can project droplets further. So the state requirements for performers is 25 feet of separation between the performers and anybody that's, you know, observing. So it doesn't get into, does each person in the choir need to be 25 feet apart? So those are nuances that you just need to think about, is how you position the folks in the choir, so that one person isn't right behind another one, are going to be helpful. But that's what the requirements are for performers, in order to address that singing. And that's something to be thinking about within your overall facility. If the entire, you know, group is all singing, those are other things to think about, is having people 6 feet apart is again, that's sort of a generic number that's mostly protective. It's not 100% protective just for normal situations. And then for singing, it's going to add additional risk. So again, this is where we get into those numbers of putting more and more people into an indoor space, and singing increases the risks quite a bit. So I think that's why you see numbers that are quite low, and lower than I think many of you would like them to be.
All right, Kelly, you have your hand up.
Yeah, I do. Thank you, Corinne. I just, one of the things I wanted to say was, and it kind of goes into what we're talking about here, is that there are, you know, this guidance, there's lots of gray areas between partners, right? So we're having these conversations with schools, we're having them with municipalities. And so we're trying to be consistent in how we're applying these, in the same with y'all, right? So, so some of the school guidance is also trying to address like bands and choirs and other things like that. And so those are things that, you know, some of ways we're still getting some clarification on possibly, but those are questions that, you know, you could send to us and we could probably figure out how can we respond to those as well. But, you know, like I said, this is not, you know, there's not like a, you know, what we're trying to do, some of the odd questions you have from CU to everyone else. We've had 3 meetings already today with different sectors, including our Parks and Rec and things like that. And all these same questions are coming up, very similar. So, you know, that's, we're hearing from all sides.
And we're getting feedback on here saying that some of the churches and other facilities are choosing not to put their choir at any risk, even if there are allowances. They're choosing just to err on the side of maybe having a recording, or, you know, doing something a little differently. So I appreciate some of the feedback. I want to respect people's time. Real quickly, go ahead, Lane.
That actually is pointed out, I didn't have it up yet, so I wanted to just confirm that choirs should not be used at this time, given the strong risk of viral spread from singing. So
Yeah,
Oh.
that's a recommendation from the state. Yeah, absolutely.
It's a recommendation. So on that special variance for outdoor events, how long is the variance approval process?
as far as how long does it take to get something approved for an
Mhm.
outdoor service?
Yeah.
It really is a little bit dependent on sort of what's happening with our team, but for the most part, if you've looked at all the requirements and you've put together a well thought out plan that addresses all the risks, that can happen fairly quickly within certainly days. Again, a little bit dependent on what's happening with our team, but we should have bandwidth to be able to look at those and review those and get back to people certainly within a couple days.
And then a question about, do wood floors need to be disinfected between services?
Would floors need to be disinfected?
Wood floors.
Wood floors. Ah, okay.
No, the only exception I guess I would say is if this is an area that young children are going to be in, where this is a play area, more of something that's like a Bible study or even a child care component that is offered, that's going to be treated a little differently. But as far as for the main house of worship or the main kind of sanctuary or whatever you call your main spaces, you don't need to clean those. We're really looking at high touch surfaces, your doorknobs, maybe any railings that people would touch, things like that. But you don't need to go through and disinfect the entire building. That's a waste of resources, and people are not going to be getting exposed on the floor.
And then 2 questions about small groups. Do small group meetings outdoors need approval?
You don't need approval for any of the things that are within safer at home. So that's an important distinction, is if you have the capacity to have 50 people in your house of worship and you can space them all 6 feet, you don't need to send anything to us to get that approved. The only thing that needs approval is when you want to do an outdoor service that's going to be above 175. So if you can meet all those requirements and the recommendations that are provided by the state, then you should just follow those and continue on. But it's when you want to do an outdoor service, and then if we are able to allow accommodations indoors, then we can start looking at some of those. But you don't need approval to do all the things that we've kind of shared with you about holding your services based on what you can safely accommodate in your space.
And then there's a question, but maybe even a recommendation to do a session like this directed at addiction recovery support groups and meetings like AA. So a question about, how are large outside tents treated?
It's a good question. We've been trying to get clarification from the state, knowing that as weather changes, people might still want to have additional spaces, and what will constitute sort of an outdoor indoor space, if you will. Like if you have a tent that has 4 walls that's fully enclosed, that's one where we feel pretty comfortable. It would be treated as an indoor space now. So you need to make sure there's adequate ventilation in that space. You need to be very careful about how you're heating it, if you are, that those heaters are not, maybe gas powered, and that there's gases that, that are going to cause other health concerns within that confined space. But it's not clear how many walls can you kind of pull down and then it's now an outdoor space. But in either scenario, you're still looking at the square footage within that tent of how many people, what the maximum capacity of people could be. But we're still trying to get answers for that. We know that lots of sectors have done sort of planning like this, where they have added tent space and want to know exactly what's going to happen once colder weather and they start adding, walls to the tents.
All right, that was a lot of questions we got through, and I appreciate that. At this time, I'm going to stop the recording in just a minute. I'm going to close it out, stop the recording, but I do have a few individuals that would like to speak live. So we'll those people that want to get off after I conclude this, I'm going to promote a few individuals to live. So if you want to stay on and be live, you have to raise your hand and I'll promote you. I do know a few. So I want to thank everybody. I don't believe I have any more questions out there. It was email, it was text, it was calls, it was, you know, the chat, it was Q&A. So I appreciate everybody's patience as we got through all the questions. I appreciate Boulder County Public Health being on today. I appreciate everybody on the call that got the information out there, because I think the number one reason for having today's call was so that we're all on the same page, that we have the resources, that we have the information, and that we have the context so that we can have the dialogue going and we can get your questions answered, provide the feedback and the information. I know that the answers that a lot of people got today were not necessarily the ones you wanted to hear, but let's keep the dialogue going. Let's keep asking the questions, and let's keep doing this for our community, for our health, and for our economy. Again, I work for the Chamber, the Boulder Chamber. I work with the other chambers throughout the county and putting on these webinars, and we'll continue to support our places of worship as well as other businesses through that. And I appreciate the partnership with Boulder County Public Health. I'm going to stop the recording at this time. And I'm going to